Clinical examination of the central nervous system. Examination of the motor system. Let's look at the examination of the tone. So there are several ways for testing for the tone. So you must learn and be conversant with one method and try and test the tone in all patients so that you are familiar with the normal, reduced and increased tone. Different ways for testing for tone. With the patient lying supine and well relaxed, first you flex and extend the elbow joints and you note the resistance offered to the movement. So you can use a wrist joint or any convenient joint for that matter instead of elbow joints. Until you raise the whole limb and you allow it to fall on the bed. You note the speed and manner in which it falls. You may have to catch the limb, especially the leg, to prevent the limb landing on a hard surface and injuring the patient. And third, you hold the hand in the greeting position. You pronate and supinate the forearm, and you note the resistance impacted to the hands. Fourth, you hold the proximal end of the wrist or foot and shake it up and down, noting the resistance to the movement. The tone must be decreased as hypotonia or increase in hypertonia. Hypertonia may be spastic, that's pyramidal, or rigid, that's extra pyramidal. So let's look at spasticity. So in spasticity, the resistance to passive movement increases initially, and as the movement is continued, the resistance falls away. That's a clasp 9 phenomenon. That's referring to the resistance experienced when the blade of a pen knife is opened. So rigidity, the resistance to movement is sustained throughout the movement. And this is described as lead pipe rigidity. And when the tremor is superimposed on the rigidity, this becomes jerky and is described as cog wheel rigidity, as seen in Parkinson's disease. So a brisk movement is more likely to initiate the clasp 9 phenomenon, and the patient must remain with the muscles relaxed throughout. Nervousness could actual or expected pain will cause the patient voluntarily to resist the movement imposed by the examiner and make testing for tone impossible. So if the patient is unable to relax, distract his attention by conversation while continuing the examination. Occasionally, in a patient with suspected Parkinsonism, the tone in the neck muscles may be increased and may be examined by rolling the head from side to side on the pillow. The power in the neck is tested by opposing voluntary flexion of the neck and by pressing on the forehead and the trunk muscles to the test. Also by asking the patient to sit up from lying flat with the arms folded. Deviation of the umbilicus during this movement implies weakness of the anterior abdominal muscles on one side.